Hi, my name is Dr. Stephen Copit, and I'm here from Mangat Copit Plastic Surgery in Avon, Colorado. So I'm in my 28th year in practice after I finished my training. So training for plastic surgery is going to be 4 years of college, 4 years of medical school. I did 5 years of general surgery training because that's what you have to do before I did a 2-year plastic surgery residency. Cosmetic breast surgery would encompass breast augmentation, breast lift, breast reduction, um, those three. Depending on which surgery you do, whether it's augmentation, reduction, or a lift, the vast majority of patients we do as an outpatient in our outpatient surgery center. They go home that day. There's no drains or tubes required. You have a wrap on for 48 hours. Most patients will come back to the office. We take the wrap down, and then you're in a soft bra, sort of a non-conforming, any soft, comfortable bra, like a sports bra, for anywhere from 2 weeks to 6 weeks, depending on which surgery we do. Most people, whether it's an augmentation, a lift, or a reduction, can be driving within a day or two back to a desk kind of job within a week. Lifting is like 4 to 6 weeks till you're working out in the gym. Lower body exercise is usually as tolerated, so most people start power walking and then they can increase it to running over a few weeks. Riding a stationary bike you can do whenever you feel up to it. It's really all those surgeries, it's really the jostling and movement that would be uncomfortable. But really the main restriction is not lifting heavy objects or lifting weights for 4 to 6 weeks. But most people are back to work within a week or so. So the idea is saline implants have literally just salt water in them. So you can imagine that the viscosity or the thickness of the fluid is very thin. So saline implants are going to be rounder in appearance, and they're going to have more ripples, or what we call fold flaws. Silicone implants, the gel inside the implant is thicker than water, than salt water. So it's going to feel softer, it's going to lay a little more naturally, a little less round, and will have less of that rippling, which we call fold flaws. Most patients can feel some rippling, usually in the outer aspect of the breast. It's not that common to see rippling. In really thin patients, you can sometimes see the rippling of the actual implant. The majority of patients today use silicone implants. They're the most studied device in the history of the FDA. We have a lot of information that we give patients to read through. The truth is that silicone implants have a very good complication profile, and are highly effective, and for the vast majority of patients will look better. So what we try to do is educate patients about both kinds of implants, and if they can't quite wrap their arms around the safety of silicone, saline augmentation is a very appropriate operation for many patients. Every day I see patients who think that implants have to be exchanged every 10 years. The reality is that if you take all the implants and lump them together, I think a fair number is that about 8% of implants will have a little rent in the capsule or the shell of the implant, or have what we call a ruptured implant, although I don't think rupturing is really an accurate description for what occurs, but about 8% at 10 years. So about 8 out of 100 implants at 10 years will need to be replaced. Silicone implants do require some screening with either mammography, ultrasound, or MRI. Saline implants, if they were to deflate, you would absorb the salt water and the breast would be flat. So they don't require the same kind of surveillance that silicone implants do. Yeah, so all reductions lift. So when we're making the breast smaller, we are also tailoring the skin or creating a tighter skin brassiere to lift the breast up. So if your breasts are going from bigger to smaller, we always do a lift. We can also do a lift and keep your volume the same. So there's some patients who just have breast droop, but like their volume when they wear a bra and lift everything up. Those patients will just have a lift. Augmentations is just about size. So that when patients who have a breast augmentation want a larger breast, we can do a lift in conjunction with that, But implants don't hold anything up. So implants are just going to make your breast bigger. The shape we can adjust at the same time. Sensation to the nipple and areolar complex is an issue for any breast surgery. So augmentation can have usually some temporary numbness from just stretching of the nerves. The incidence of permanent nipple numbness for augmentation, breast reductions and lifts where we're making an incision around the nipple and areola. I mean, I tell most patients somewhere around 3 to 5% of patients will have some permanent numbness. The problem is when you tell somebody that it's 5%, if it happens to them, it was 100% to them. So there's always an inherent risk of numbness with breast surgery, but the incidence is low. Yeah, I think the biggest misconception is that patients know who's had cosmetic surgery. Because good cosmetic surgery that is natural, where the size or the shape of the breast or face or body is appropriate, most of those patients won't tell anyone that they had anything done. So everyone thinks that every breast augmentation is overly large, that everything is overdone, because our best cases, the ones we hope we're putting on the street every day, are patients who maybe don't tell anybody. It's a horrible business model in cosmetic surgery because we're only known by the results that you can see, and those are the rare exception and the ones that we hope we're not doing. So the vast majority of patients with breast augmentation, for instance, pick a very appropriate size that looks very natural, that they may never tell anyone and no one would ever know. Breast augmentation is not, every patient is not someone who just wants very large breasts. Some patients have asymmetry that makes certain outfits and clothing difficult to wear because the breasts are such different sizes and shapes. Some patients breasts are so small that the clothes don't appropriately fit, and they literally just want to fill out clothes that that fit them everywhere else. We see a lot of patients who've had kids and really just want their old breast back, just want a little bit of volume back to replace what's atrophied after breastfeeding. And that's the vast majority of patients. Most patients just want an appropriate size that looks really natural.